जो वर्क लाइफ बैलेंस एंड टॉक्सिसिटी एंड टॉक्सिक ब्रांचेस एंड ये जो एक फैल रहा है दिस रेगुलर in the crowd, how do you take this? How do you explain this?
Optimizing the use of manpower. ना ही आप किसी के हेल्थ को बर्डन कर रहे हो, ना ही यू आर मेकिंग देम फील लाइक बर्नट आउट, एंड पेशेंट का काम जो है वो भी चल रहा है.
This answers many of the questions about MD versus an MS branch, and that is what our whole perspective is, to help you choose about the right branch and about what you should prioritize and what is made for you. अब एक चीज और आती है कि we have got multiple clinical subjects, long working hours. What I've seen the tradition changing nowadays. That's a trend. People are getting brainwashed about choosing those branches कि जो आपको एक kind of leverage दे सकें to stay away from a very high amount of workload, because your work life balance, the so called, gets changed. Sir, हमने कभी work life balance के बारे में सुना ही नहीं था. We never, आज की डेट तक हमें work life balance नहीं पता है. So because we enjoy working, at the same time we have a good balance with life, क्योंकि automatically हमें अपने लिए time मिल जाता है if we have a good work life as well. तो ये सर, ये जो वर्क लाइफ बैलेंस एंड टॉक्सिसिटी एंड टॉक्सिक ब्रांचेस एंड ये जो एक फैल रहा है दिस रेगुलर in the crowd, how do you take this? How do you explain this?
See, there are 2-3 things. जो वर्क लाइफ बैलेंस के बारे में बात हो रहा है ज़रूरी भी है, एट द सेम टाइम एट टाइम्स इट गेट्स ओवरडन. आई विल गिव यू एग्जांपल. एक मेडिकल कॉलेज से एक स्टूडेंट थी जो मेरे नीट पीजी के लिए she was following me. So when she got into the PG, she felt her seniors are very toxic. Like वो बोल रहे हैं कि ये करो वो करो. When I tried to understand the perspective, I realized कि वर्क लाइफ बैलेंस ये टॉक्सिटी के बारे में इतना बात हो गया है that anything that your senior instructs you, she was taking it as toxicity. कि सीनियर मुझे कुछ बताए ही नहीं, I will just want to have a free run. ऐसा भी नहीं चलेगा, right? Because the process of learning involves working. So without working there is no learning. She was expecting that मैं जो भी बेसिक काम मुझे डायरेक्टली मेरे यूनिट हेड से मिला है वो करूँगा, फिर निकल जाऊँगी लाइब्रेरी में, आई विल रीड हैरिसन और वॉच वीडियोस, एंड दैट इज़ हाउ आई विल बिकम अ गुड मेडिसिन डॉक्टर. बट सीनियर्स की वहाँ पे जाके वो लंबार पंक्चर करके आओ या ये रिपोर्ट वहाँ से कलेक्ट करके आओ, एंड शी वाज सीइंग इट एज टॉक्सिटी. सो आई ट्राई टू like tell her that what you're thinking is not right. You don't have to see everything from the toxicity angle ki there should be no hierarchy, there should be nobody telling me or instructing me anything, I will just walk into the wards and walk out whenever I want. She was not convinced, so she kept ranting, and I had become her like talks to me were her therapy sessions ki she will rant. But when she went into the second year, she quickly adapted to that senior role. Now she was instructing her juniors, and her rants changed from कि juniors कुछ काम ही नहीं करते हैं, simple से instruction follow नहीं करते हैं.
Which she herself did do it.
So it's like students also have to realize that the medical branch, the medicine as a whole field involves a lot of work. किसी न किसी को तो ये काम करना ही है, तभी तो patients के जो problems है वो solve होंगे. या आपके HOD आप नहीं करेंगे तो आपके HOD को करना पड़ेगा, या तो आपके सीनियर्स को करना पड़ेगा, किसी ना किसी को तो काम करना पड़ेगा. देयर इज नो एस्केप फ्रॉम वर्क. सो इफ everyone tries to escape, someone has to bear it, and that is where things get little messy or complicated. तो ये एक अंडरस्टैंडिंग के साथ हमें अपने रेजिडेंसी में जाना है कि आई हैव टू वर्क, आई एम नॉट गोइंग हियर फॉर रीडिंग, इट्स वर्क.
There is no shortcut to success.
There is no shortcut at all.
तो if you are working, तो you will have to make sure कि आपके चाहे जिस भी फील्ड में आप जाएं, be it any clinical field, you will have long working hours. You will have to devote that many hours, especially in your first year. I think first year is a commando training, para commando बनाते हैं, क्योंकि you will have long working hours, because and that is something that is saving you for a lot of things later on. Because if in 3 years you learn very well, then later on you don't have to spend that much time and resources and money to learn that skill from someone else.
The only thing I want to change in this landscape is कुछ जगहों पे there is unnecessary toxicity created, in the sense कि अगर काम एक आदमी से हो सकता है, like one resident can handle this load, but still the institute या HOD या unit आपको force करता है कि मेरे units के सारे PGs 36 hours hospital में ही रहेंगे, even if the work available is only for one person, that is toxicity. मैं ये नहीं कह रहा हूँ कि 36 hours shifts are something that should not be absolutely done. हाँ, there is physiological stress on the body, but if it is balanced well, कि हाँ जो पेशेंट के लिए काम है वो होना चाहिए, उसके लिए अगर 24 घंटे का काम लगता है तो उतना करेंगे,
तो patients
12
come
घंटे,
first.
हाँ, पेशेंट कम्स फर्स्ट, पेशेंट्स वर्क शुड बी डन. एट द सेम टाइम द सिस्टम शुड बी ऑप्टिमाइज्ड so that the manpower is utilized well, so that the others are not burdened. अभी मेडिकल कॉलेज में क्या होता है, हाँ आज ओपीडी डे है, आज सारे पीजीज फुल शिफ्ट करेंगे, सुबह आएंगे तो नेक्स्ट डे इवनिंग तक उनका शिफ्ट चलता रहेगा. आज ओपीडी में बैठेंगे शाम तक, फिर नाइट ड्यूटी करेंगे, नेक्स्ट डे मॉर्निंग एज यूजुअल पोस्ट ओपीडी राउंड्स, देन सेकंड राउंड्स, सब खत्म करके ही घर जाएंगे. बट इफ़ यू डोंट हैव सो मच ऑफ वर्कलोड, व्हाई टैक्स एवरीवन टू बी इन द हॉस्पिटल? यू कैन डेलीगेट द वर्क टू 1 or 2 पेजेस, तो बाकी जो पेजेस आज शिफ्ट नहीं किए हैं वो नेक्स्ट ओपीडी में करेंगे. सो दैट्स लाइक ऑप्टिमाइजिंग द यूज ऑफ मैन पावर. ना ही आप किसी के हेल्थ को बर्डन कर रहे हो, ना ही यू आर मेकिंग देम फील लाइक बर्नट आउट, एंड पेशेंट का काम जो है वो भी चल रहा है. बट आई हैव सीन दैट देयर आर लॉट ऑफ मेडिकल कॉलेज जस्ट रोड रूल्स कि हाँ हार्ड वर्क से सीखते हो तो सब हॉस्पिटल में, हाँ सभी हॉस्पिटल में पड़े रहेंगे, वो भी नहीं चाहिए.
बट यहाँ पे आपकी स्मार्टनेस काम आती है, हाउ टू एक्चुअली मैनेज योर वर्क, बिकॉज यू आर ग्रोन अप इनफ टू अंडरस्टैंड दैट हाउ स्मार्टली यू कैन delegate work, how smartly you can get your work done. And that is where I feel कि PGs interns को बहुत बढ़िया utilize करते हैं, that interns को भी they will learn through this, and the delegation of work will make it very very simple. So what we learn is that what sir is saying, please don't choose your branch thinking कि ये बहुत toxic है, ये toxic नहीं है. Every branch has got the same amount of learning experiences, every branch has got same amount of workload, because the more the workload, the more you learn, the more you learn later, the more you earn. So it's as good as that. You are not signing up for sitting in the OPD, having a cup of tea and having a good work-life balance. In the initial years, if you have a very good work-life balance, later on you will suffer, because in your city you might have 10 people doing better than you, because you never got experienced in the earlier part of your career about those subjects. So very correct, and I think this answers many of the questions about MD versus an MS branch, and that is what our whole perspective is, to help you choose about the right branch and about what you should prioritize and what is made for you. So
Sanchit sir, I have a question. See, one of my student, like, see, these questions I kind of keep getting regularly, and it's a common confusion also. So student has got a rank, the desired branch is medicine, he's got a rank. At this rank he's getting the MD medicine, like he's from a very low socio-economic background, so cannot afford a private medical college, expensive seat, so he is getting a government medical college seat in a remote medical college like district place or a small center, not in the metros, not from the premier government medical colleges. And he is going to get the DNB medicine in Saint Stephen and some of the premier DNB institutes. And he is confused कि मैं MD medicine एक peripheral medical college से करूँ या DNB medicine from a premier DNB institute से करूँ. So I have my own perspectives, but ENT also has DNB program as well as MS program. So what's your perspective?
So sir, this is one of the very important questions that you highlighted. बहुत बच्चे ये पूछते हैं कि MS या MD versus DNB में later on what problems they will face. Yeah, what prospects DNB holds over MD, or is MD superior over DNB? So let me be very clear, DNB and MD hold the equal importance in front of anyone. They are equal degrees, they are equal, number of years that you devote. Both are made for 3 years. There is no basic difference between the two. The only thing is DNB training primarily happens in a clinical setting, where you will get more clinical exposure. MD has got a more professional setup as far as teaching is concerned. So DNB, I won't say will have that many classes, or they will be going and they will be having those lecture seminars and all those things. MD has got more of a structured program, if you say, like general clubs would be there. There would be lectures, there would be seminars, there would be postings. DNB might not have, because that would be happening in a hospital setting. Many of the foreign institutions still regard DNB as a better degree than MD if you go outside. Many of the Indian institutions train MD superior to DNB. So it all is institutional. Coming to, is there any difference post and pay scales? There is no as such difference. Both make you equally skilled. So if you really want to, go into, I would still say, if you really want to do a medical college job, I
Yeah.
would say MDs get a priority over DNBs.
Yeah.
In a private hospital setting, equally you get DNB versus MD, don't have any problems, you can go. If you want to go abroad, DNBs are given a little over advantage than MDs, if I'm not
Yeah.
incorrect here.
So just to add few points to what you already listed. So legally, both the degrees are equal degrees. They're equivalent, except for the teaching purpose, because where the logically also because DNB training happens in like hospitals where you do not have undergraduate students, so probably you would not have taught any lessons to undergraduate students. You don't have that so-called teaching experience. I personally believe that teaching boils down to the person. You are inclined to teach, you will teach anywhere. Like अलग सर ने तो फिर YouTube से start किया था.
कहीं भी.
हाँ, कहीं भी. At least law mandates you that you should have an additional year of senior residency before you become assistant professor. MD या DNB या MS starting to senior residency से ही होता है. But you might have to do one more extra year of senior residency before they promote you to assistant professor if you're coming from DNB background. But frankly speaking, medical colleges do not financially reward well. So I don't see it as a good career path. Because जितना medical college HODs को pay करता है, उतना with 3 years of experience post PG, you can easily make it in your private hospital or your own practice. So medical colleges are primarily meant for those who are passionate about teaching. It's not for I don't say that don't expect too much money from the medical colleges.
It is for the learning part, because even as a surgeon you are going to a medical college, so you're doing certain surgeries which you really want to improve in your skill set in a medical college setting, which you won't be able to do in a private hospital. So that is also that you'll get that load in a government hospital setting.
They're not, medical college is not a good long-term career choice.
Absolutely. Okay. Because that growth gets inhibited.
Yeah. Other than that, there are few things that you should consider when it comes to debate versus DNB versus MD. In the DNB institutions, you will get exposed to most of the modern infrastructure because it is the corporate hospitals which are running the programs. So you need an MRI. I still know that there are a lot of medical colleges which do not have an MRI available at till the radiology department gets the PG seats. They're not going to get the MRI because it's a requirement nahi hai. They will only run with the basic CT scan. Nuclear medicine departments do not exist in most of the medical colleges, but they are there in big corporate hospitals. So that is an advantage that you get exposed to more modern practice. But at the same time, you will rarely see a patient with rheumatic heart disease walking into a corporate hospital.
Correct.
You will see most of them in the government setup. Rarely you will see the miliary TB cases in a private setup. You will see them frequently in private setup. So the kind of patients you get exposed to is different in two programs. That's a real difference. But then how much I lose if I get into DNB instead of MD? Basically, you're losing some of the common diseases which you might encounter once you come out of DNB in your private practice. But I personally feel all it takes is 6 years of senior residency or registrarship post your PG. And that fills all the gaps.
That will solve the gap.
Like if you're done from, let us say, DNB from a corporate hospital, get into a medical college, do 6 months of senior residency, and you don't have any lacunae. And if you're from a, let us say, peripheral government medical college, you've done an MD there, and you have no exposure to all modern infrastructure, do 6 months of registrarship, which is kind of senior residency in a corporate hospital, and whatever your lacunae are there, they are filled. So don't base your decision on whether the institute is going to give me DNB degree or MD degree for your choice.
And
consider
this is
other
also
parameters.
About the institution you placed. So I always would say that if you have got MD in an inferior institution, which is in a periphery versus DNB in a better institution, you should take the institution over the degree.
Yeah.
So
because
agree. Institutions are very important here in post-graduation. Suppose if I talk about MS, in MS if you go to a periphery center and if they don't have the equipment or the mentorship, then what is the point of having MS? And if you can learn that much in DNB, in a better institution. So give institutional preference a choice. That is always there. Don't worry, MS, MD or DNB, it's all about the same thing. It's all about your caliber, how far you can take that field forward.
See, I have one question now. What do you think to the patients? Do they base their decision whether I should consult this doctor or that doctor based on whether he has MS or DNB?
Initially, what I personally feel, initially people were not knowing what DNB and MD and MS is all about. They used to see the boards jitna lamba line hota tha na, they used to follow that doctor.
Yeah.
That is a patient psychology. But what I still say is majorly it's all about the initial months in practice, about creating that name.
Yeah.
It's about the initial months, about the struggle, how to get the patients to your side. I still say if you get one person right, they will call 10% more.
Yep.
If you fail on doing a justice to one patient,
Yeah.
they will take away 20 patients away from you.
Yeah.
It doubles up. So it's all about the word of mouth. In the initial part, you will have a difficulty in creating a practice equally in MD versus DNB or MS versus DNB. Because generally psychology क्या होती है, patient MS देखता है, तो they run after. But I think trends have changed now. People have become more aware about the degrees.
Exactly. See, now in the recent times, the DNB seats, the numbers has increased. And second, see, good thing is that the current generation of students, they are not spending too much time. See, हमारे टाइम पे क्या होता था कि 5-6 attempts to get that MD or MS नहीं मिलेगा, then people would think of going to the DNB route. Now they are not. They are like, I have a lot of students who are taking the DNB medicine in the first attempt. It is their internship attempt. They got the NEET PG decent rank, and they're not waiting for another attempt for MD. They're getting into the DNB. So good crowd is getting into the DNB. Second, number of DNB seats is increased. So now you go to any corporate hospital and see the list of consultants. You will see 5-6 MD and another 3-4 DNB. So people are, the patients and the family, they're seeing the DNB quite often now on the...
Yeah, and obviously now people have started to understand about that these are equal degrees. There's been a lot of debate, and it carries the same amount of clinical exposure as any field would. Right?
Yeah.
So that would be it. And I think we have already discussed a lot of things about what is MD, what is MS, how you should choose a branch, what you should choose, what you're suited for. But the whole takeaway message is that do something what suits you.
Yeah.
You are tailored for something. You've been created for something.
Yes.
Don't mix and match by people who are telling you what to do. Follow your dream, follow your feeling, follow what your gut says, and you'll sail through, and definitely you will excel in life. So thank you, Santosh sir,
Thank you, sir.
for such an excellent and such a lovely, experience that you shared from your side about both the fields. And this would be it from our side from PW Podcast.